वेलकम टू ऑल सभी व्यूअर्स को एंड माय गेस्ट स्पीकर सबको वेलकम गुड इवनिंग। मैं डॉक्टर गायत्री पंडित राव होम्योपैथिक फिजिशियन हूँ पुणे से। सभी दर्शकों का डॉक्टर्स डायलॉग सीरीज में मैं स्वागत करती हूँ। आज का हमारा चौथा सेशन है, सेशन 4। तो मैं पहले अपने गेस्ट स्पीकर को इंट्रोड्यूस करूंगी। Our speaker for today's topic is Dr. BG PB. She is from Kerala, but currently from Mumbai. She has done her BAMS, that is Ayurveda, and MD she has done in Panchakarma. Welcome, Dr. BG. Nice to have
Thank
you
you.
in this session.
Thank you so much for inviting.
Yes. तो आज का टॉपिक है हमारा साइंस बेस्ड एविडेंस बेस्ड आयुर्वेदा, राइट? तो बिफोर वी जंप इनटू दिस टॉपिक, I would like to first have a bit of chat with you, regarding little bit of history. Past 2-3 साल में जो कुछ भी हम लोगों ने महसूस किया, एक्सपीरियंस किया.
Yes,
So
yes.
I just would like to you to share with the viewers, as well as if there are some doctors who are watching this, that what was your experience during pandemic actually. So can you share a bit of your experience?
Yes, yes, doctor. I was doing my final year PG in 2020. 2020, that time the lockdown happened. So our college was all the IP patients were discharged and it was taken over, and for 1 or 2 months it remained closed, and after that it became a first line COVID treatment center.
Okay.
Only OPD was functional. So the PG students, ours was almost complete. Our thesis work was almost complete that time. But our juniors find it difficult to. They didn't have cases to do their work and all. And also one thing happened is allopathy doctors also came, and in the COVID center we were posted for COVID duty. And what we have to do is swab collection, and we are not allowed to treat with Ayurvedic medicine because there was a protocol and you have to follow the protocol. And what we have to do, you have to wear the PPE kit and you have to go for rounds. And whatever complaint their patients are telling, you just have to note it down, and you are not allowed to prescribe any medicine. Medicines will be prescribed by allopathy doctors. We are a team. We made a team of Ayurveda, allopathy. Every system was incorporated and it was taken over, and it made a COVID center.
Oh, so you were on the field that time.
Yes, yes. On
So
the
you
field.
must have seen a lot of COVID patients also, right?
Yes, yes. COVID patients also, and we were in a what helpless situation. We can't do anything. Just we can hear the complaints, but we can't advise anything. So that was a very difficult situation. We are like in a helpless situation. What we are supposed to do, we are not able to do. So we find it very handicapping type of a situation, and we fight along with Dr. Rajkumar sir and Ramya ma'am also tried for a, we want to treat, give me if they are giving 5 or 10 pilot cases, we are able to do all these, we were suggesting, but nobody was responding to that. And I think on the second wave in May 2021 only, Ayush was given approval to treat,
Permission.
permission
Yes.
to treat. But we
Yes.
saw.
But then the officials which were there, like
We
what?
contacted them. We asked them whether we can do diet and lifestyle modification. Even if you allow that, also we can do changes. They are not listening to that. Also, no, there is a protocol. It is like disaster management rule is implementing. So you have to obey. You have to obey. No, no complaining. Only obey. That was the situation there during the pandemic.
But as a doctor, like as you being an Ayurvedic practitioner, what message I would like to you to share, that what could have been done in those period wherein the other allied doctors also would have been helpful to face this crisis.
Actually, what they are selling, we don't have a data because they are seeing COVID-19 as a new disease, new virus, and no research is done on it. So how will you treat? That is the question that we have, that the question we faced. But we have a definite protocol. We don't depend on which virus, which bacteria. It is working with the whole system. How the environment
Can you
inside our
speak
body.
little bit in Hindi? Can you speak little bit in Hindi?
हाँ, yes, definitely. द प्रॉब्लम इज कि हमारे बॉडी में जो वायरस आ रहा है, जो बैक्टीरिया आ रहा है, उसके अगेंस्ट जो मेडिसिन नहीं है. वी आर नॉट ट्रीटिंग, आयुर्वेदा इज नॉट ट्रीटिंग इन अ वे against this virus this medicine, this bacteria this medicine. It is not like that. We are working on the host immune system of the body. So we are making an environment inside our body so that it is not compatible for the virus to grow. So we are making the host environment as such, so that the infection will come down as early as fast as possible.
हाँ, सो मैं व्यूअर्स को बताना चाहूंगी कि डॉक्टर बीजी कह रही है कि इन आयुर्वेदा ऑल्सो, यू कैन करेक्ट मी डॉक्टर बीजी इफ आई एम गोइंग रॉन्ग, दैट यू आर सेइंग कि इन आयुर्वेदा भी ऐसा है कि इम्पोर्टेंस बैक्टीरिया एंड वायरस
बैक्टीरिया को
को
नहीं है.
नहीं दिया जाता,
हाँ,
बट योर ओन इम्यूनिटी को दिया जाता है, एंड और
इम्यूनिटी
आपके
को.
आयुर्वेदिक प्रोटोकॉल्स उस पे ही बेस्ड रहते हैं, राइट?
हाँ, our body has a capacity to heal by its own. हमारा बॉडी अपने आप ही हीलिंग प्रोसेस में आ जाता है, लेकिन हमको उसके लिए एक प्रॉपर एनवायरनमेंट प्रोवाइड करना होता है ताकि द बैक्टीरिया एंड वायरस विल नॉट ग्रो एंड हेल्थ विल ओकर.
अभी आपने, अगर हॉस्पिटल में बेस्ड थी आप और आपने इतने पेशेंट्स देखे ऑन फील्ड, तो आई वुड लाइक टू आस्क यू कि द नरेटिव विच वाज गोइंग अराउंड इवन टिल नाउ कि ये लोग दे आर ट्राइंग टू यू नो एक्सप्रेस इट एज अ वेरी डेडली डिजीज, लोगों के ऊपर फियर जनरेट हुआ, डरने लगे. तो मेरा क्वेश्चन ये है आपसे कि आप इतने पेशेंट्स देख रहे थे, तो पेशेंट के जो सिम्टोमेटोलॉजी थी, तो आपको कुछ अलग लगा या इट वाज लाइक व्हाट यूजुअली वायरल फीवर या हम पहले भी देखा करते थे पेशेंट्स में?
Age, according to age, it was a first line center, so mild cases came to us. And if the patient is young and he has a good immune system, he is recovering in 2-3 days. But they are allowed to, we are allowed to do test only on the 7th day. First day, if they are coming, they are positive, and second day, if they are second day or third day, if they are symptomless also, the testing is after completing these many days, you have to test. So that people were okay by the time two or second or third day they are okay, but they are still allowed because of the quarantine. Test kit, number of test kits are less, so you bar test nahi kar sakte ho. So after 7 days everybody will be symptomless. They'll be roaming around here and there. They'll not adhere to their bed even. मतलब they are normal हो गया.
You believed
So
in
they
this testing protocol?
test, and after 7 days testing also happens, and mostly it was negative. Everybody is tested negative. Very rarely only we got positive result when during my duty time.
ओके, क्योंकि हम लोगों
Because
को तो नंबर्स, पॉजिटिव नंबर्स बहुत आ रहे थे in those days, so many cases were positive and all, so that created a lot of
main fear that people had was they are isolated from their home. If mother is there, then the kids are not allowed. So small kids be allowed inside, because they, what can we do? The kids, if they are very small and breastfeeding below 3-4 years, they don't stay with their grandparents or something. Then kids are also allowed. If they are negative, also they has to be allowed.
psychological effect was more.
Psychological effect was more.
And what reactions you as a doctor were getting from patients actually?
Patients were complaining about their difficulties, but we are in a handicapped situation. We can't do anything. We can't prescribe medicines. So we are like, we can't do anything. We have to do something. That sort of mentality we had. We tried to talk to our professors. Can we do something? Can we take mild 5 cases? Mild we can take and do something. nothing happened. We requested and nothing happened. And later on, when we got in the college union and all, tried to get this permission for treating and all, we have submitted memorandums and all. And finally, in May 2021, I think they have given permission so that Ayush personals can also treat. And by the end of May 26, we started this Hastalamba program under the guidance of Dr. Rajkumar sir and Ramya. They are the pioneers of SEPA. So what we
Okay.
have planned is there are
We'll come to
volunteers.
that. We will come to that. But before that,
But
one more
actually,
thing.
this problems, everything what we face, resulted in a positive outcome. That is
Positive
Hastalamba.
outcome. Yes, for you that time. But now I will ask you about one more outcome that has happened recently. Is you must be aware of Ayush collaborating with WHO. And recently, in last week or so, I think on 16th and 17th in Jamnagar, Gujarat, this global summit took place
Okay.
of Ayush. So, what are your views regarding this collaboration?
Mm-hmm. Actually, WHO is treating Ayurveda as a traditional system of medicine. So
Yeah,
in tradition, what happens is everybody will be following the same thing. It is like as in generations what they are told, and people are what they are following from time immemorial. What the grandmother was following, the daughter will also follow, like that it is passing on. But there is no how, why, how it's happened. No scientific data is there. You can't explain what is why it is happening, how it is happening. You are not able to explain. So Ayurveda is not like that. It's a proper science. Everything is explained with a cause-effect mechanism. Everything we call it as Karyakarana Siddhanta. If something is happening, there will be a reason for that. So accordingly, everybody can't we can't fix one medicine for all the people, because according to the state and stage it will differ. We can't give like a tradition. It is followed, so you have to follow. It is not like that.
यस डॉक्टर रम्या जब आई थी मेरे सेशन पे तभी
हाँ हाँ,
उन्होंने भी यही एक्सप्लेन किया था कि व्हाई आयुर्वेदा शुड नॉट बी कॉल्ड एज ट्रेडिशनल मेडिसिन एंड
traditional
व्हाई
medicine.
इट शुड बी कॉल्ड एज अ साइंस अभी मेरा आपसे आगे का क्वेश्चन यही है कि व्हाई टुडेस टॉपिक यू हैव chosen as science based evidence based ayurveda which I prefer. I think it is SBEBA you call it as,
SBE,
right?
हाँ हाँ हाँ,
So
yes.
my question is now, आप science based and evidence based, ऐसा why are you using these terms? What was the need for you to use these terms? ऐसा क्या हुआ है कि we doctors need to try to prove ourselves and prove any science actually.
हाँ
So
हाँ
what are your thoughts? Or if possible, try to speak in Hindi so that viewers.
हाँ, okay. Science-based, evidence-based is the name coined by our pioneers. It is formed. It is Ayurveda as it is. Ayurvedic scientific Shastra Arthas. What are the meaning of verses? We are learning the just the word meaning, and there are some inner meanings also. Matlab you have to understand that in a due course, or by deep study you will understand. थोड़ा सा अंदर की बात बता सकते हैं, थोड़ा सा शास्त्र
Okay,
का
deep
inner meaning,
scientific.
inner meaning. हाँ. So all this the diseases you have a what have told us is the Karyakarana Siddhanta. There is a cost effect mechanism. So accordingly, we can explain each and everything. So there is a science-led evidences. It is not the statistical evidences that we are applying. We are giving same medicine. एक ही medicine सब लोग को दे के 30 लोग को दे दिया और उसमें 20 people got okay and 10 people ऐसा नहीं, because 20 people को वो सूट किया है तो उसके पीछे एक कारण होता है ना. 20 को क्यों सूट किया है, 10 को क्यों सूट नहीं किया है. So that also we can apply, and we can apply science and correct all the 30 patients. So that is the peculiarity. If if we are concentrating on medicine-led evidences, same medicine has to be given. Normally, researches happen in that way. Now, same medicine will be given to a community.
All.
How many research people we are taking? For all the subjects, the same medicine will be administered and the result is studied. But you can't. Every individual is different. Every situation is. You have to tailor make it particular to that situation. Then 100% result you will get. but we can't
Correct.
concentrate that on a medicine base. We can concentrate it on a science based thing. So that
Correct.
is what is meant by science based, evidence based.
ओके, सो आपके भी इसमें आयुर्वेदिक मेडिसिन एंड ऑल के ट्रायल्स होते ही है, लाइक बिफोर इट कम्स इनटू आयुर्वेदा
Actually,
फार्मेसी, राइट?
Ayurveda. Actually, we are already text में जो medicines already mentioned है, उसी को ही trial करके reprove कर देते हैं. It is already proved and it is in the science itself. We are not allowed to, nothing new, new drug is not formulated and it is not experimented. Whatever is mentioned is the science, that is the Shastra itself. No?
राइट.
That only we are taking and implement, doing studies.
ओके, सो इट इज पेशेंट बेस्ड, राइट? आयुर्वेदा इज आल्सो पेशेंट बेस्ड, राइट?
Stage and state of patient, of
स्टेट
the
एंड
particular condition based, particular.
condition based. Right. So now I'm getting more interested in asking you कि कोविड में भी आप आयुर्वेदिक प्रैक्टिशनर है, तो आपने एक मेडिसिन दी रहती, या यू वुड हैव ट्राइड विद डिफरेंट मेडिसिन ऑफ आयुर्वेदा फॉर
We are
पेशेंट्स?
not allowed to. We are not allowed to
नो नो,
try when we are doing the,
इफ यू वुड हैव गिवन अ चांस, तो आपने,
what
यू
we
वुड
have
हैव,
done is
हाँ,
what we have done is non-medicated first aid we have provided. We have even
ओके,
my family also got affected with COVID, and all the other family members. What we have done is we have taken non-medicated the first aid protocols, diet and lifestyle we have changed, and other people are saved from getting infected. It can be possible. We have already done many cases.
नहीं,
It
वाई
is
एम,
a
मैं क्यों,
non-medicated.
हाँ,
People
नहीं
will
मैंने
not
क्यों
believe
ये,
this, and it can be cured without medication. Only with the lifestyle and diet modifications it can be cured. What a big mountain had made na COVID karke. But what we
राइट?
have proved is, more than 500 patients we have completed. Otherwise, in our family members also, in our relatives also, that they are not registered, but we know them and we have advised them. If they follow, they'll get result. In our family also have done that. In my family also.
ओके, नहीं मैंने क्यों पूछा, क्योंकि आई एम अ होम्योपैथ, सो
हाँ,
हम लोगों में दे हैड फॉर्म्ड अ जीनस एपिडेमिकस, हम बोलते हैं कि
हाँ,
यानी
हाँ.
एपिडेमिक्स अगर आए एपिडेमिक, तो उसमें
Hmm.
1 or 2 रेमेडीज दे ट्राई टू फाइंड आउट कि जो
Okay.
इट विल बी एप्लीकेबल एंड विल गिव रिजल्ट्स फॉर मेजॉरिटी ऑफ पीपल. सो
People.
दैट वी
हाँ.
कॉल इन होम्योपैथी एज जीनस एपिडेमिकस, उसको बोलते हैं.
Genius.
तो इसलिए
Hmm.
आर्सेनिक यूज किया गया. सो एवरीबडी,
हाँ.
हर जगह पे आर्सेनिक फेमस हो गया, बट हम में से
Okay.
बहुत से होम्योपैथिक डॉक्टर्स ऐसे थे हु वेर अगेंस्ट दिस प्रोटोकॉल ऑफ आयुष,
Whatever.
क्योंकि
Okay.
हम
Okay.
लोगों का कहना था कि आर्सेनिक सिर्फ एक ही मेडिसिन नहीं है कि जो हम लोग
Mm-hmm.
दे सकते हैं पेशेंट को. देयर वर
Okay.
मेनी अदर रेमेडीज ऑल्सो विच कुड हैव वर्कड
Mm-hmm.
एज पर द केस, बिकॉज
Uh-huh.
एज यू सेड इंडिविजुअलिज्म रहता है. होम्योपैथी में
Yes.
भी
Yes.
हम लोग
Mm.
give importance to individual person as a
Individual.
whole.
Uh-huh. Mm.
So it's not always that one remedy suits everybody, even though
Everybody.
it is
Huh.
epidemic, because
Okay.
many doctors
Symptoms
had
may also
claimed,
vary. Symptoms
huh,
also differ. Na? Everybody is
exactly,
having the same infection. Then why the symptoms differ? Because the person is different.
exactly,
Huh.
person is different. So
Mm-hmm.
there we align, I suppose. So that's a good
Mm-hmm.
thing that even
Mm-hmm.
Ayurveda and homeopathy things quite alike. Now let's go to what you were talking about. What is this Hatalamba program?
Astalamba.
If
Huh.
possible, try to
Astalamba.
explain in Hindi. क्या, हाँ, उसका origin कैसा है, क्या है?
Okay, Astalamba का origin is from the desperate condition where we were not allowed. हम लोग को treatment के लिए allow नहीं किया है ना. We are not allowed to treat. From there, we May 2021 में we got the permission that we can do treatment, but you can't advertise this medicine करके. It was not allowed. But individually, if people are coming to your OPD, you can treat like that. It came. And under the guidance of Dr. Ramya ma'am and Rajkumar sir, we formed a group of doctors. We have a chief coordinator, Dr. Hari Krishna Bhatt. He is from Mangalore, and Ramya ma'am and Rajkumar sir are from Kerala, Mahi. They are associate professors in Mahi College. So they and along with 2020 21 other Ayurvedic doctors who are into SBEBA, and they have the similar mentality. Along with that, we have volunteers. Volunteers are also Ayurvedic doctor or non. We have given training to volunteers and coordinators, and we have a team of technical support. So from the pioneers, head coordinator is there, and 2020 24 this coordinators are there. They are Ayurvedic doctors in Sarda. They are handling cases with the help of volunteers. Every day we have to call the patients and all. Na? So that non-medicated, and the peculiarity is no medication were used. Even COVID positive patient, no, without medication. We'll advise morning, say, we'll advise the routine, what are the food you have to take, and what all regime you have to follow, each and everything, even small details. We'll take half an hour consultation and we'll explain each and everything to the patient. Before, at the time of registration, we are doing a blood test. From the blood test, we'll assess the patient, what is his, how much variation is there, what is his CRP raised data, ESR raised data. Then we'll examine that, and accordingly, what we prescribed is the medicated water. That too, people were quarantined. People were. It was a second wave. It was a time of second wave of COVID. So people are isolating at home only because hospitals were already full and people don't want to go to hospital. That situation happened in the second wave. First wave, mein, everybody was hospitalized. That time we were not allowed to treat. And second wave, mein,
Right.
only serious cases were hospitalized. And mild cases, system also asked you stay at home, and if you are getting worsened, then come to hospital. That was the guidance given. So that time when they are isolating at home, they we come with this program called Hastalamba. There is a link. It was a link was created, and you can register with your details. Only name and phone number you have to upload, and then you will be registered to this Hastalamba. And then the doctors will call you. They'll explain you. They'll advise you a blood test, and we also took a consent because we are treating online and all. That time online consultation was allowed, but also we took a consent because they are following it rightly. We took a written consent. Along with that, initial basic blood test, CBC CRP was done before treatment, and after that we advised them the guidelines, and the people followed. And after 3 or 4 days, even COVID positive patients got reversed and they become healthy. And after treatment also, we ensured that they do a blood test so that we can record it, and everything else, data is there with our head coordinator, and everything
So
is
this is
documented.
तो ये
This is the
सिर्फ फीवर
only fever, viral fever. We don't
वायरल
insist on COVID. All the viral fevers, even the link is active now. Even अभी भी आप कोई भी viral fever से problem लग रहा है तो आप उसमें register कर सकते हो. I have given the link in my PPT, so you can click the link and register. It is a free service. We are free of cost. No, we are not paying anything, and it is all these online platforms that started during COVID are almost wind up now. By the time now, it is 2 years, and but we are still continuing. Still, all over the world, we are getting patients, and we are doing that free service for the society. We started during the COVID time to help the people who are isolating at home. We were desperately in need. Trying to help them. We were not given a chance. When given a chance, we started it to help the society as a free service. It was a voluntary program. You can register, and many people have got benefited from Hastalamba. Many feedbacks are there. You can visit our SBEBA Wisdom series. We have a Facebook page, SBEBA Wisdom series. So आप उसमें visit करेगा तो from 2020 it was started earlier also. Before COVID it was started, the FB group. COVID time you can see feedback of patients who are registered in Astalamba. The COVID patient, positive cases were also there. What are the handwritten feedback is uploaded in that. Before after CRP changes, CRP even come down 26 CRP within 2 days it come to 12. Then after sixth or seventh day it was 6, below 6, normal.
oh
So
right
all these were recorded, properly recorded.
yeah but what you said was medicative water you are telling right
No medication was given. What we have prescribed is whatever they have at home, because that time lockdown was there. People were not allowed to go and collect some herbs from the Ayurvedic shops, they are not
So
around. So simple.
home remedies, right?
You can call sometimes. If the condition was chronic, we have prescribed some herbs that
Okay.
you have to collect from a shop. But
Okay.
otherwise, if it is a mild case, we have treated with whatever that is available at home. Even abroad
Okay.
patients के लिए भी they are no, Ayurvedic herbs are not available for the people who are staying abroad and all. So in that cases also we have treated with the medicines that are available with them, with what are the drugs that they have. Simple home, everybody is access to that we have used. And
Right.
what the principle we have used is that medicated water may even fever may, the importance of taking hot water and
Yes.
cold water for an alopecia or other system ke liye it is the same. It is water. One is hot, one is cold, but there is a difference between water. It is becoming light. It is stimulating metabolism. It is easy for digestion. It is helping digestion. So all these
आप ये
changes will
थोड़ा
happen with
हिंदी में बोलिए, आप ये थोड़ा हिंदी में बोलिए, पानी, गर्म पानी का,
गर्म
सो दैट
पानी.
व्यूअर्स.
अभी
हाँ.
कि जो नॉर्मली बरसात के मौसम में या बारिश के टाइम पे एवरीबडी विल ऑटोमेटिकली स्विच टू हॉट वाटर, बिकॉज दैट इज द टाइम. वो बारिश के टाइम पे नॉर्मली अपना डाइजेस्टिव अग्नि जो बोलते हैं ना, वो वैसे ही वीक हो जाता है.
Right.
So people have the tradition also, and that is scientific also, to use hot water. So that
गर्म
hot
पानी.
water will stimulate digestion. गर्म पानी digestion को stimulate करता है, and it will be light. What is the difference when water is cold? It is heavy, and when it is boiled, it is becoming light. And that water will be get purified also by boiling it for some time, because the germs will also be killed. And that water is effective in stimulating metabolism. And with simple herbs we are putting in that according to the stage. And we can't advise कि आप ये डाल के पानी पी लो. Normally home remedies में ऐसा होता है ना, आप कोई भी हो, without blood test nothing, everybody will be advised the same, you do this. In COVID के time पे भी you have seen all those things ना, many home remedies
Yes.
come up, many WhatsApp messages come up. It's not, we have not done like that. We have, everybody was documented, everybody has gone through a blood test, and according to the blood test only, initially when we are consulting, we'll tell these are the dietary guidelines. Dietary guidelines are somewhat similar, but the medicated water we'll prescribe only after seeing a blood test. And the concentration, how much you have to put, how many is it has to be reduced or it has to be just boiled. All these will be decided by the amount of what are the blood parameters. It
Right.
is directly related to the blood parameter. We don't have a same protocol that can be given to all the patients. Every patient has to be analyzed, and according to the blood parameters, you have to prescribe how much they have to take, how much quantity may. What are the proportion to the medication that has to be added to prepare that medicated water. So
Okay.
likewise, things are different.
आपने अभी गर्म पानी बोला, इसलिए आई एम वेरी ईगर टू आस्क यू वन मोर क्वेश्चन. आई थिंक वी एज डॉक्टर्स गेट दिस क्वेश्चन very commonly from patients, that is it good to have early morning hot water, उसमें शहद डालो और नींबू डालो, and then you drink that hot water. So
Okay.
from Ayurveda perspective, आप बताइए कि शहद और नींबू और गर्म पानी, इसका like is it really workable, because बहुत जन ये लेते हैं रोज. So what is your perspective, Ayurveda
Uh, Garam pani is
perspective?
advisable, but if you are mixing something, the property will change.
It will change.
It will change. Honey, what you are getting, the quality, everything will decide. You can't ensure whatever you are getting is pure or not. Na? That is the first problem. And second is if you are putting lemon, lemon is
Hmm.
a sore item. Sore item is contraindicated in inflammatory status. So you can't advise the lemon to all the people.
Correct.
Somebody will be having acidity, and morning may if you are taking lime water, so you can't advise this as a common this thing. Garam pani you can advise, okay, if you are
Exactly.
taking hot water, but if you are mixing anything, you have to check the state and stages of that person, that individually only you can tell. You can't make a
Right.
general statement key you can take this. how long, whatever. And people will start using, if somebody is advising, people will start using. I got a
Exactly.
patient. I got a patient. She is in the middle age, 40, around menopause के time हो गया है, and she is having severe pain, and periods flow is not coming. She is having distension and pain in the abdomen. And
Okay.
I asked her routine, I asked her diet, I asked. So that was during the COVID time, and she told me from the COVID time when people are advising to take this honey and water, na, so I am following it, and every month I am taking this much of honey I need, so that I'm consuming this much of honey. But it was a big amount of honey per month, uska consumption, and she'll put 2 spoon and mix with honey, and what it make her body dry.
Hmm.
एंड ऑलरेडी मेनोपॉज के टाइम पे बॉडी थोड़ा ड्राई हो जाता है, ऊपर से शी वाज टेकिंग हनी, seeing some YouTube video, I guess. She started using it. It was good for immunity, whatever she had followed it, and continuously following, and she ended up becoming so much premenopausal symptoms, early premenopausal symptoms happen, and she consulted, and I asked her to stop only that thing.
करेक्ट.
Um,
सो मैं यही व्यूअर्स को बोलना चाहूंगी, बिकॉज ईयर्स टुगेदर पीपल आर डूइंग दिस. इफ यू सी, आप जैसे बोल रहे हैं कि यूट्यूब चैनल देख के पीपल स्टार्ट इंडल्जिंग इनटू सम फॉर्म ऑफ,
indulging
दे
in
फील कि
the,
ये ट्रीटमेंट है, लेकिन उसका विपरीत परिणाम
कोई
होते रहता है
परिणाम होता
शरीर
है।
पे, ये उनको समझ में नहीं आता है. सो आई वुड रिक्वेस्ट थ्रू दिस मीडियम सभी व्यूअर्स को कि अगर आप ऐसा कुछ एवरीडे बेसिस पे, एक दिन, आई एम नॉट सेइंग दैट एक दो दिन लिया तो
हाँ,
कुछ हो जाएगा, बट इफ यू
हाँ,
आर कॉन्स्टेंटली
लॉन्ग
एक
रन में
चीज आप
एनीथिंग
ले रहे हैं, सालों साल, 4 साल ले रहे, 5 साल ले रहे, फिर भी
दैट इज
इफ
हार्मफुल।
इवन आई हैव सीन पेशेंट्स, मुझे जब कोई कोई बोलते हैं कि मैं आई यूज दिस हॉट वाटर, क्यों, तो उनका रीजन है दिस इज वेरी फेमस फॉर लूजिंग वेट. That is what they say. Lekin I always tell them that it's not suitable for everyone. So now, since you Ayurvedic doctors are more what you say, expert in herbs and the the what you say, the intricacy of each and every ingredient, that is why I asked posed you this question, because many times I feel that people are not doing this in a right manner. और
यस
अपने को लगता है कि ये बिल्कुल छोटी चीज है, बट
चीज है, हाँ,
छोटी चीज इफ यू डू डेली फॉर लॉन्ग पीरियड
डेली।
ऑफ टाइम, ये अपने बॉडी
Even
को
if
अफेक्ट करता
medications also, if you're
है.
prescribing medication,
एग्जैक्टली.
you're prescribing for 10 days. Yeah, maximum.
एग्जैक्टली.
And after that, what happened? Without asking, without follow up, they'll continue using. That is also bad. If it is
दैट इज
prescribed
ऑल्सो
for 10 days, it is for 10 days. We are not intended to take it like whole lifelong, or not like that. Whatever it is intended in that period, in that dose, you have to take. And for
करेक्ट.
in YouTube channel, what is the qualification of starting a YouTube channel? Everybody can start. No,
ट्रू.
nothing. Otherwise, if otherwise you'll be going to the most senior, most qualified doctor and all. But if something is there in YouTube, you are like, people are like, yeah, YouTube mein aaya hai, and this he has such a lot of followers. It is not a criteria. It is not the criteria where health you can implement and you can experiment on your body. It's a very, very.
नहीं, इसीलिए हम लास्ट सेशन में मैंने यही टॉपिक डिस्कस किया था थोड़ा, कि हम लोग भी होम्योपैथी डॉक्टर्स दवाई लिख के नहीं देते हैं कभी कभी. व्हाई? बिकॉज बहुत बार क्या होता है, पेशेंट्स एक बार लिख के दिया मेडिसिन, सो दे नाउ नो दैट इफ पेट खराब हुआ तो मुझे ये दवा लेनी है, लास्ट टाइम दिया था डॉक्टर ने. व्हाट हैपेंस, दे टेक इट बाय देमसेल्व्स नेक्स्ट टाइम.
Themselves.
बट द प्रॉब्लम इज कि हर बार पेट खराब
पर
होने का कारण अलग अलग रहता
कारण
है,
अलग
ये
होता
उन
है,
लोगों
हाँ,
को समझ में ही नहीं आता है.
हाँ,
सो
हाँ,
नाउ
हाँ,
व्हाट वी डू इज फ्रॉम आवर साइड वी डू सम चेंज, कि वी डोंट राइट द
okay.
नेम्स until unless it is really asked by some patient कि आपने क्या दिया
Patient,
है, दवा
क्या
तो
दिया
लिख
है,
के.
हाँ, हाँ।
समटाइम्स काउंट ओवर द काउंटर जाके
Counter sale,
मेडिसिन
over
लेते
the
हैं
counter
फार्मेसी.
sale of medicines.
इवन आई थिंक आयुर्वेदा में भी बहुत से मेडिसिन लोग फार्मेसी में जाके
अपने आप,
ले
हाँ,
लेते हैं.
अपने आप ही लेके जाते हैं, उल्टा ही कोई भी they'll have a problem, dryness of skin or anything like that. It may be because of the internal problem that they are having. It may be a skin manifestation of the systemic disease they are having, but they'll correct it systematically. But ये तेल लगा है, वो तेल will be contraindicated in that condition, but they'll apply some oil something and it will get worsened, and then they'll end up somewhere and they'll blame Ayurveda. That is what is happening,
Right.
because the intention, how they used it, who told them to use all these, nobody is asking about that.
Correct.
So
So
simply
what
Ayurveda is
what
getting blamed.
yes, so what suggestion आप viewers को क्या suggestion दोगे इस मुद्दे पे? Over the counter medicines और अपने आप
Always
medicines?
consult the doctor before taking anything, even if it is so small, something as early morning, some honey or water also. Sometimes it will be suitable for your body, but you have to consult. Can I take it? And don't take anything for a long duration.
Time.
If some problem is there, take that medicine and discontinue it after that if you are getting, and or take a follow up, do a follow up, and what has to be, you can initial stage may we'll treat the infection, and the second stage, if we are coming for a follow up, then what we can do is, such tendency can be, its recurrence can be prevented. What
Correct.
is there in your body that is causing this problem, that can be sorted out, that can be that can't be treated in the first stage, so that comes in the second stage. So that will be different from the first stage. So you can't do apne aap hi wo, no, you have to follow this. Yeah, next time also this the thing will repeat. If you are not coming for a follow up, then the problem will repeat, and you will take the first. You will be in the first level only. You are
Hmm.
not coming to the ultimate. उसका correction नहीं हो रहा है. So follow
Correct.
up is also important.
आज ही मेरे पास एक एग्जाम्पल है टू शेयर विथ यू. This patient of mine has two daughters. She
Mm-hmm.
used to stay in my society, but now they have shifted. But still, she calls me up, and on there were few medicines जो हम biochemic medicine बोलते हैं, Barakshar. If you must have heard, they are the salts, okay,
Okay,
and
okay, so
medicines are prepared from that. It's a different stream, you can say, but it
okay,
goes in nice alignment with homeopathy medicines. तो
yes,
हम
yes.
होम्योपैथी मेडिसिन के साथ वो भी
You are
प्रिस्क्राइब
also
करते
doing
हैं
this.
बायोकेमिक सॉल्ट्स. तो बायोकेमिक सॉल्ट्स आर सेफ दैट वे,
Mm-hmm. That.
पोटेंसी मेडिसिन से. तो मैंने
Mm-hmm.
उसको, मैं बहुत से पेशेंट्स को ये बायोकेमिक सॉल्ट्स लिख के देती हूँ कि यू कैन कीप
Okay.
दिस एट होम, सो इन केस ऑफ इमरजेंसी यू कैन यूज इट विदाउट आस्किंग मी फॉर फ्यू डेज,
Okay.
3-4 days.
Mm-hmm.
So 3-4 days back, उसके बेटी को बुखार आया. So the
Okay.
weather is also like that. She started with that
Mm-hmm.
biochemical medicine. For
Medicine.
2-3 days, it didn't reduce. One day it
Mm.
reduced. Again, yesterday she was having high fever. Now
Fever.
on
Huh.
fourth day, she called me up
Okay.
and she said
Very
that
good.
you had given me that biochemic, so I gave
Okay.
first that. I told her,
Mm-hmm.
why 3 days you wasted? Because
Mm-hmm.
consa bhi fever, if we usually see, it's viral
Mm-hmm.
fever always usually have 72 hours of period, like after 72 hours
Mm-hmm.
also automatically the fever reduces.
The lungs will
But
come down.
in her case it was not happening. But
Happening.
पेशेंट को ऐसा लगता है कि नहीं ये दवा डॉक्टर ने लास्ट टाइम दी थी, so she started with that. But patients are not able to gauge or do some prognosis कि ये कहाँ
Mm-hmm.
जा रहा है. And the
Yeah.
child is 4-year-old child. अगर उसका
Okay.
high fever कम नहीं आया होता, there,
Mm-hmm.
then she started lose motions, then she got a little
Motion.
bit panic कि अभी मैं क्या करूँ, then she called me today. So already
Mm-hmm.
4 days have gone. You understand?
Already.
So
Yes, yes.
sometimes these are the problems which you must be aware that we as
Uh-huh.
doctors do face.
Yes, yes.
और हम लोगों को व्यूअर्स को यही बोलना है कि इसीलिए हम we always ask viewers to consult the doctor and do not take medicines by yourself.
Your
That
own.
is the major message I would like to give
In
everyone.
all other field, it is not there. If any other
Yes,
problems happen, they'll go to the specialist there. If law related something hai, so they'll go to the lawyer. Or
exactly.
all the other things, they are doing it properly. But in the case of health only, they'll ask the neighbors, they'll search YouTube, they'll do everything other than consulting a doctor, and finally they'll come if it is everything fails, then only they'll come to
Exactly.
for a
And then it
doctor.
becomes very difficult for
Very
us to
difficult to
handle
treat
that case,
treat
because
also.
it, yes, it advances to a certain stage and then it becomes difficult.
Mm-hmm.
Anyways, So now I would like you to go ahead with the topics that I think you are going to share about infection and allergy and all.
Yes,
So you
yes.
can go ahead and
Okay.
explain. You want the PPT? I can ask her. Yes.
Yes, yes. It's already there, no?
Yes.
So this is science-based, evidence-based Ayurveda. We have already explained that it is Ayurveda as it is, because our society needs to get the best out of Ayurveda. So what we can provide is with a minimum medicine, SBEBA. By using SBEBA techniques, the people are getting reversed. The problem can be cured, so that and no hospitalization is required. You can do it in no OPD basis, so that the working hours, the patient has no need of taking leaves, no need of missing the school time, school hours. You can go to school, everything, but you have to follow some guidelines that that we are insisting, that has to be followed with minimum medicine, so that the cost of treatment will be very less. It will be very cost effective. Minimum one, yeah, maximum two medicines will be there. And along with that, dietary protocols are there, because what we are insisting in treating an infection is not based on the which bacteria, which virus. We are not based on that. How our host environment is. If our environment is compatible for the virus to grow, then it will automatically grow. If it is not compatible, we are making an environment such that they are not active, so they are not getting that opportunity to build up. So it will reduce, it will come down to healthy state as early as possible. So that is the basic principle. And Seba Ayurveda Shastrarthas are incorporated to specific guidelines. For diabetes, we have guidelines. For Jwara, we have each and every guidelines, and you can refer to that. All Ayurveda doctors can avail the facility of science-based, evidence-based Ayurveda. It is Ayurveda as it is. So the cost of treatment will be less. So the herbs used will be less. So the country's GDP will also increase. Number of hospitalization will come down. So that is what Sabha has to offer to the society.
Okay.
So the
थोड़ा
motto
हिंदी
of
में भी
Sabha is,
बोलिए.
we never treat, we enable. उसमें हम ज्यादा दवाई देके ट्रीटमेंट करने का तरीका नहीं है. व्हाट ऑलरेडी द बॉडी को अपने आप ही हैज इट्स ओन इनेट कैपेसिटी, इट्स ओन एबिलिटी. उसको ताकत है, खुद हील होने का ताकत है. What body, why the WBC cells will be increased in an infection? Because white blood cells are the fighting cells. It will be increased in
Right.
all sort of infection. It will be increased to fight against this thing. It is not a problem. Increased WBC cells is telling us that body is already in the fight mode. It is fighting against the virus or bacteria, whatever that is coming to our body. So body is in a fight mode. Then what if you are giving heavy food? If your digestive system should be, what you have to do is should be light food, so that the body can take the energy to fight against the infection. Or immune system has to be the most active system, not the digestive system. So accordingly, what you have to do is make your food and regime in accordance with the condition, so that the body can heal the infection on its own. What we have to provide is the environment for that the body can heal on itself, with minimum medicine, with minimum supportive medicine, with a proper diet. It is not like you have to do fasting or something. You have to take the nutrition. You have to take scientific nutrition in that state and stage. What is necessary, that you have to take. You can't take more than that. You can't take less than that. If you are taking less than that, then fatigue will happen, and it will lead to other problems. So accordingly, you should take food that should be incompatible. That time you have to take the food that is advised as per the chart, according to your diet schedule. What all modifications on a personal consultation we can do that. Okay. So for a prescription, we can't do a prescription. These through medicine you can take this much. We'll explain how and why it is happening, and what you have. If you follow this, what will happen? It is very transparent. We can explain within 2 days this thing will happen. Within 2 days the temperature will come down. You will feel hungry. You will feel active. you'll not feel lethargic. All these changes we can explain one to one. If you follow this, the next day this will happen. Everything is transparent, and you can explain it very easily. Okay, so very small amount of medicine will be prescribed. The scientific nutrition schedule. It is like I got if it is in an infection stage, it will be different. In allergy, it will be different. In prameha, it will be different. In diabetic cases, it will be different. So it is like scientific nutrition schedule is also according to the state and stage where the person is. If he is not in an inflammatory or infective status, he can take that medicine. He can take normal food also. So state and stage is more important in deciding the scientific nutrition schedule and the dose. That will be purely based on state and stage, and lifestyle modification also. If you are a normal healthy person, whatever if you do in your lifestyle, it will not affect you. So we are seeing also na in young age whatever incompatible या विरुद्ध आहार भी बोलता है मतलब uncompatible combinations also people are having, and no issues are there. But if you take it in a disease state or in a old age, then the people will affect with one single meal they'll be having problem. So because the body has become sensitive to that, body is easily reacting to these things now. So we have to understand that accordingly we have to modify our diet.
Now, one question only, I will interrupt, sorry. I would like to ask now, since you're talking about diet, okay?
Mhm.
So quickly, मेरे दिमाग में एक चीज आई कि आजकल जो डाइटिशियन के पास सब जन जाते हैं, right?
हाँ, हाँ,
And
हाँ,
dietitian will give, they will try to give you a protocol to be
हाँ,
followed maybe for 3 months, 6 months at a stretch. लेकिन
ओके,
अगर उसके बीच में अगर किसी को
आपको
यू
कुछ
नो
प्रॉब्लम हो गया।
हाँ प्रॉब्लम हुआ, दे
हाँ,
दे फॉल सिक, सो
हम्म,
जैसे आप बोल रहे हैं कि डाइट
हम्म,
चेंज करना चाहिए व्हेन यू आर सिक,
हम्म,
isn't
हम्म,
it? So then
हम्म,
these people, will they get affected if they do not change whatever dietitian has told
dietitian
them and
has
if they keep on?
prescribed.
So what you want to say?
You have to follow the diet what doctor is
Doctor
prescribing
has
for a stipulated time. Maybe it will be 7 days, maybe 5 days. Maximum, it will not go beyond that. Between that time, you can reverse if you are coming in the initial stage. If it is coming in a complicated stage, it may take some more time. But it is like you have to adhere because dietitian will be prescribing the food according to the healthy stage where you were before 3 4 months. That can be
correct.
followed in a disease condition. If you are taking lemon also na a lemon also every day, if you are taking in infective status, if you are taking sour items, secretion will increase. If you are running nose and if you take a lemon juice, the next day after taking after half an hour you will see that oh ये पीने के बाद मेरे को ज्यादा हो गया. If you are conscious and if you are observing your body, you'll you can observe
Exactly.
that. If you are not observing, you will not get that knowledge.
So
If you
हम
are
सब
observing,
व्यूअर्स को ये बात वी विल लाइक टू
you have to
स्ट्रेस,
observe you should observe what is happening in your body.
observe your body and
Body.
you should
What
follow
it
the
is
diet
trying to
which the
communicate with
doctor
you.
tells.
It is
Right,
trying to communicate with you, and you are not hearing at all. you are so you have to
exactly.
communicate. You have
तो
to
आपको
understand that.
आपको अपना डाइट थोड़े दिन बाजू में रख के यू हैव टू लिसन टू योर डॉक्टर
Listen
हु
to
इज
it.
कंसल्टिंग यू फॉर योर
Exactly.
ailment, and
प्रॉब्लम
then
हाँ
go
वो
back
बहुत
when you
जरूरी है.
become healthy, you go back to your
Go
diet
back to
schedule,
your diet.
right?
Maybe if you are on a diet for 5 6 months, if you are on sprouts or some mostly salads will be there, all the raw uncooked foods, na, it is
Hmm.
heavy for digestion. You have to understand that it's heavy for digestion.
It is heavy, raw
Heavy
food.
food is raw food is heavy, so you have to if you cook the food it will get light. So all these
Yes,
things, if you are taking something for a long duration na, it may result in some problems. Maybe that may be the cause. If you analyze na, if you analyze what was your diet for the last 2 3 months, then only we'll reach the conclusion what is the cardia, what is the cause factors.
correct.
So if you are allowing the cause to happen again and again, and you are treating from one side, what will be the net effect? Net effect will be zero. because cause is continuing, because what are the causative factors, it is still allowed. And medicine is also you are giving.
Hmm.
You have to stop the causative factor, then you have to start with medication. So the first step in the treatment is to hedu vibhidi, we call it as removing the cause. What is
Hmm.
the causative factor of the disease has to be identified and stopped, and opposite you have to do, so that the person will be healthy in 4 5 days. Because if he has habituated for a long duration, it may take some more time. If it was a short duration thing, and the amount is also amount of through blood parameters, you can understand how much CRP is raised. If it is above 50, then it will take time accordingly. So we can assess the how much time, quantity, and quality we can assess from a blood report, and
Right.
accordingly you will prescribe medicine. Accordingly, you will prescribe dose. So all these factors are important. It is like you have to take quantity also, quality also, duration also. You should check, and then you will prescribe the duration of medicine, the dose of medicine. Everything is depend on. You can't
Yes.
say कि 10 days में 10 days के लिए लिख रहा है, then you have to come for a follow up. So उसके आगे क्या
हाँ.
करना है? That is
राइट.
also important.
आई थिंक यहाँ पे जब आप कॉज बोल रहे हैं तो हम लोग
Yes.
भी होम्योपैथी में वी से दैट प्राइमा कॉजा बिकॉज कॉजेटिव फैक्टर्स आर आल्सो मेनी
Many,
बिकॉज प्राइमा कॉजा मीन्स द कॉज व्हिच इज द बेसिक टू
basic cause.
गिव सम एलिमेंट एंड जैसे आयुर्वेदा में आई थिंक कफ वात पित्त बोलते हैं वैसे हमारे भी इसमें भी डिवाइड इट इनटू सोरा सिफिलिस साइकोसिस देयर आर 3 स्टेजेस दैट वी go into. So I would like to ask you how this causative factor in Ayurveda you define. Like, is it based on these three things, or there is some different way that you tackle these causes to find the exact cause?
Causative factors, mainly
These
it is
are constitutional. I mean, the constitutional
constitution.
constitution of the patient.
Constitution is of the patient is in his healthy state.
No,
We'll
right,
decide it from birth how he is, how
right.
his what during his childhood, how was he chubby or was he a lean person, how was he attained puberty early or it was late. All these factors will be assessed for assessing the pragardiya, what is the what you call the constitution of a patient, of a person. That is of a person. He is,
Of-
it is his innate nature. It is a person as it is. But according to disease
Yes,
status, it will differ. But we can get some clues because he is having this prakriti, this constitutional,
right,
this constitution say hai is this person. So in that person, this type of problem may come. So likewise, we can assess in disease status, prakriti is not important. It is the disease ka state and stage is important. If he is in an infective state, if it is not in an infective stage, all these things matters a lot. If he is
right.
in a so that is what is deciding factor.
Okay,
Prakriti can be assessed in a healthy state, and disease status, then we have to assess the go for a blood test and assess how much problems are there, what is the CRP, what is this, how much WBC raised there. All these are the main factors in a disease condition. In a healthy individuals, we can assess the Prakriti, and accordingly, we can advise if you are doing, you have to follow opposites of your Prakriti so that you will be healthy, because our
right.
body has a tendency of this constitution, and if you are following the same thing, it will go in excess and it will cause disease. So opposites we have to incorporate as in a consultation of prakriti. What we can tell is, we can advise this will be suitable for you, or if you are following this, we will be disease free mostly. That is the advice we can give, that can
Okay,
be
you
given.
can continue with your PPT. Yes.
Okay, okay. So next slide. I think we have covered. Next slide. Hastalamba, it is a helping hand. Hastalamba means already covered, na everything,
Yes.
because it was
Minashri,
it
you
was
can go to next slide.
ha ha. Maybe
Next
it will
slide.
be the link for Hastalamba will be the next slide, I guess. Now, this is the this is a link where people can access the services still available. If you are, it is a season of fevers once again. Na? It is a barish ka mosam and it is a season of fevers. So, if you're registering in Hatalamba, you will get a voluntary service of non-medicated, only with diet and lifestyle changes. The fever, all these things can be cured, can be reversed, and you'll feel the difference. Many of the feedback में ये आता है. Normally, if you're taking medicines, you'll be feeling very lethargic. You'll not be active. You'll not be able to go to work. But with Hatalamba program, the people will feel active. Active. They are having with
What is VFFA? It's viral fever something.
viral fever
VFFA.
first aid program. Yeah,
Okay.
Hastalamba is VFFA,
Viral fever
Hastalamba
first aid
viral fever
program.
first aid program. It is a first aid that can be done so that it will not go to the next stage.
Aggravate, huh? It won't
Aggravate.
aggravate.
Do not aggravate. So this
Next,
is
next
for
slide.
the next slide. This is for registration if you want. Then
हाँ
coming
ये
to gynecologist disorder. Gynecologist disorders may main cases what we are getting is PCOS. Many people are affected with PCOS nowadays because of the it can be managed mainly with lifestyle and diet modifications. And
आप
according
थोड़ा
to
हिंदी में बात कीजिए and explain what this PCOS is.
PCOS. It is a polycystic ovarian syndrome. Many people will main symptom of it is amenorrhea. Periods नहीं आएगा, weight बढ़ जाता है. Proper ovulation cycles. If you are doing a scan and if you are observing na, proper follicles are not forming. Follicles ovary से एक follicle ready होके आना चाहिए so that ovulation will take place properly and it may PCOS is related to infertility also. If one egg is not forming properly, then ovulation will not happen and it may result in infertility. So, what is happening in PCOS is all the follicles are getting because of excess nourishment or excess hormonal and excess hormonal activity. All the follicles will be normal से थोड़ा बड़ा हुआ. So, selection of one is not happening. There will be multiple follicles and no follicle is getting selected and ovulation is not happening and so there will be amenorrhea because periods नहीं आएगा उसमें periods का delay होता जाएगा and weight बढ़ेगा and pimples will come. Pimples is one of the problems because excess sebum secretion will be there. Excess hormones will lead to sebum secretion and it will lead to acne vulgaris. All those pimples का एक अलग stage में जाएगा, थोड़ा ज़्यादा होके आएगा, normal से थोड़ा ज़्यादा. And if you apply anything externally, normally what skin disease skin इसमें आप जाओगे तो they'll treat only your skin problem. They'll give you skin related oilments, this thing, that thing, but it will not be cured because the problem is internal. The problem is with your hormones. Hormones. So that is so you have to reverse the pathogenesis. You can't do. And if it has reached it is reached only one stage, only amenorrhea will be there. If it has reached to the other layer problem, then obesity also will be associated. After obesity, also the problem is continuing. Then it will come to as facial pimples may come, acne vulgaris may happen, and then also if you are not correcting, and then it goes to next stage. Then hair hirsutism type ka, unwanted facial hairs may happen. So it has a progression of stage. So according to the symptom of the patient, we can understand at what level the patient is. What all things has to be done for reversing it. How much medicine has to be advised. So accordingly, the state and stage will differ, and according to the symptoms are very important in that case. According to the symptoms, we can assess how much infected it is, how much deeply it has gone, and accordingly you have to treat. And then coming to for PCOD or PCOS treatment, no Panchakarma treatment is advised. Nothing is needed because it is produced due to excess nourishment or excess this thing. You can't. Normally, people has a disbelief that Panchakarma is like elimination therapy. So excess is if it is there when if you do Panchakarma, then it will be cleared. It is not like that. Panchakarma, there is proper indication and contraindication. In some condition,
What
if
is
you do,
Panchakarma? You explain in short
ha
in
ha,
Hindi. What is exactly Panchakarma? Because that also is considered nowadays by people as just like some
it is a
what you say
fancy
beauty
name now.
therapy.
Panchakarma has
Yeah,
become a fancy name
it's
now,
become
and
a
in
cosmetic
every
stuff.
cosmetic this thing, and many senders the name of Panchakarma will be there, and what is happening inside will be some massage or some treatment. All these are not Panchakarma. Panchakarma are 3 5 procedures are there. One is
हिंदी में बोलिए व्हाट इज पंचकर्मा.
पंचकर्मा में 5 क्रियाक्रम होता है. वो हर कंडीशन में, हर प्रॉब्लम में वी कांट डू दैट. उसके लिए अलग अलग इंडिकेशन एंड कॉन्ट्रा इंडिकेशन है. आप हेल्थी इंडिविजुअल है, आप इन्फेक्टेड स्टेज में है, तो वी विल नॉट डू पंचकर्मा ट्रीटमेंट. इट इज लाइक आपको एक डिसीज हो रहा है एंड आपको कम मेडिसिन से ठीक नहीं हो रहा है, वो उतना ज्यादा है, तब आप जस्ट लाइक ऑपरेशन होता है ना एलोपैथी में, या यू हैव टू हॉस्पिटलाइज सम क्रॉनिक प्रॉब्लम है आपके पास, विथ ओपीडी मेडिकेशन इट इज नॉट क्योर नहीं हो जाएगा जैसा डॉक्टर को लग रहा है, देन you will be advised for a panchakarma treatment. So it is
Oh,
a
so
more
that is a
advanced
later
process.
stage. That is a
Later
later
stage,
stage.
later stage, so that the disease causative factor, if it is in small matra, if it is in small amount, you can manage it with medicine in an OPD level. If it is more than that, if it is not curing with OPD medications, firstly we'll give OPD medications, and if the duration is more, if problem is more, symptoms and more, and it has affected to deeper layers of tissues, then what we have to do is, then we have to advise the patient for a panchakarma type of procedure. We can't do it in a first stage of treatment, because the body has itself has a tendency to remove that thing from the body. If a person is having vomiting because of the indigestion, the body is trying to get it out. Vomiting is inducing, it is called vamana. Vamana is the one panchakarma procedure. That is with giving medicines, internal medicines will be given to induce emesis,
Oh,
to get rid of the problem. If it is in the upper body, if it is if the oral route is the nearest route for expulsion, then we'll advise the patient for a vamana therapy. Okay. So dosha should be whatever has to be eliminated. The causative factor of the disease should be in a liquid form also. Okay. Liquid form also, so that it has to be eliminated. Otherwise, you can't eliminate. You
right.
can't remove. You can take juice of a ripened mango, but if it is unripe, you can't take the juice. So there should be a particular stage. It should be
Stage.
ripened so that you can take the juice out of it. If you can just remove it from that, so that criteria is important. So you have, for Panchakarma treatment, there are some criteria. You should consult a doctor, and it should be done with proper monitoring. Morning, evening, twice a day you have to be monitored, and then only you should administer that. So one is emesis ho gaya. Second is purgation. Purgation.
So this
So
is
that
Panchakarma is to be done only by registered medical practitioners
medical
only, right?
practitioner only. Yes, yes, definitely.
हाँ, so मैं viewers को ये भी बोलना चाहूंगी यहाँ पे because lot of small nowadays shacks you see, small wherein
The name of
Panchakarma board
Panchakarma
is
board is
and
there.
people just go
It is
in
the most
and
misused words, I should say. It is the most misused words, and it is my duty being a Panchakarma specialist to tell to public कि ऐसा नहीं होता है. आपको अच्छा सा एक आयुर्वेदिक डॉक्टर के पास जाके अपना प्रॉब्लम को बता के उसका स्टेज उसके लिए रेडी है, तब जाके करना है. ऐसा नहीं है यू कैन वॉक इन एंड डू. ऐसा नहीं, इट इज नॉट अ ट्रीटमेंट की वॉक इन करके आप कोई भी हेल्थी स्टेज में भी कर सकते हो. वो प्रॉब्लम होना चाहिए, वो लिक्विड होना चाहिए. इफ यू आर ट्राइंग टू एक्सट्रैक्ट जूस ना, वो इफ इट इज नॉट राइपन, देन इट विल, वो फ्रूटी खराब हो जाएगा ना. तो likewise it is like it has complications also, so you should be very um,
careful,
careful in doing that.
right?
Okay, so one is vamana and the other one is inducing purgative medicine, so that is also induced according to the condition, how much you have to do. If overdose may result in complications also. Excess
Hmm.
of fluid will be eliminated from the body, dehydration may happen. But if it is done in the correct matra and correct stage, Then many diseases, mostly in skin conditions, if according to the state and stage we are using, we can see tremendous result in one sitting. Also, you can just like a step before after photo, you can see the change. So, like, it is very effective, but you have to administer with caution,
Done
with
properly.
proper supervision. That is the thing.
Correct.
Okay. Then,
Yes,
then
Meenakshi.
enema type of treatment is there, with decoction enema is there, and oil enema is also there. So that has to be done alternately. So that one is a cleaning process and one is a nourishing process,
Nourishing, huh?
nourishing wala process. Then you can put medicines in your nose is the for all your head ke liye ek hi opening hai nose. So if you put nasal drops na, nasal drops will be get absorbed, your sinus will be cleared, and any diseases of the above the clavicle diseases ke liye it will be very effective if you're doing Nasyam procedure. That these are the 5 Panchakarma procedure. Massage is not a Panchakarma procedure. Steaming and massage, all these things is propagated as a Panchakarma treatment in all the small centers like this, na?
ये
But they
ये आप हिंदी में बोलिए, ये
are
बहुत
okay.
इम्पोर्टेंट है आप जो बोल रही है कि मसाज
हाँ, हाँ,
एंड दिस इज नॉट अ पंचकर्मा, ये आप हिंदी में
Panchakarma.
बताइए उसको.
ये अभ्यंग जो बोलते हैं ना, अभ्यंग और मसाज ट्रीटमेंट, it is there in almost all the centers in Mumbai will be providing this massage type of thing, but it has its own contraindication. वो हर समय आप नहीं कर सकते हो. आप फीवर है, आपको फीवर होके आप डाउन है, तो आपको लग रहा है चलो मैं थोड़ा डाउन लग रहा है, एक बार मसाज करके आएगा. इफ अ पर्सन इज थिंकिंग लाइक दैट, इट इज रॉन्ग. इट मे एग्रवेट योर कंडीशन. So everything has its own indication and contraindication. If you are in a disease stage, don't go for अपने आप ही मसाज करना, वो स्टीम कुछ भी अपने आप से करने के लिए अलाउड नहीं है. आप कंसल्ट करके कर दीजिए. और ये अभ्यंग वगैरह जो हो रहा है वो सब पंचकर्मा में नहीं आता है. 5 प्रोसीजर्स है, वो अंडर सुपरविजन करना है. And all these are preparatory procedure before Panchakarma procedure. This has to be done, but it is अलग से जस्ट प्रिपरेशन ये कर रहा है. प्रिपरेशन करके उसको एलिमिनेट भी तो करना है. दैट इज नॉट फॉलोड. सो बॉडी में वो रह जाता है. तो ऐसा डोंट गो फॉर दैट.
करेक्ट,
ऐसा अलग
वेरी
से
इम्पोर्टेंट.
पंचकर्मा.
यस, वेरी इम्पोर्टेंट पॉइंट. एनीथिंग यू वांट टू स्पीक मोर अबाउट योर पीपीटी?
एंड मेनली स्किन डिसीज के बारे में आई वांट टू टेल कि स्किन डिसीजेस के लिए मोस्टली पीपल डू इट इज लाइक इट मे बी द it is a representation of your systemic problems. If you are having PCOS, acne may come. You will not treat your acne. Menstruation is not regular. Irregular menstruation, girls nowadays are not bothered about, because they are more bothered about the pimples that is coming in their body. So
ट्रू.
what we get will be pimples. So when we assess, when we introspect deeply, then we'll came to know periods में भी problem है. ओके, वो तो इतना इम्पोर्टेंट वो बताया भी नहीं. आप पूछेगा तो देन they'll tell, हाँ वो तो ऐसा ही है, इरेगुलर है, अभी लास्ट 2 महीने से नहीं आ रहा है. Both things are also there. But so skin manifestation, it is a mirror of your body, it's mirror of your gut, mirror of your underlying problems. So you have to take it properly. If hyperpigmentation and on a rise nowadays, so it may be related to some immune dysfunction, autoimmune problems may be the reason. It is a early indicator. If you are, it is a early indicator. अभी पहले से आप वो स्किन वाला प्रॉब्लम को एड्रेस करेगा, वो भी प्रॉपरली एक जो मतलब स्किन का what I told is, you have to treat, you have to check your blood report. If some skin related problem is coming, normally don't go for all those creams and chemicals and sunscreen ये वो, because you can read the ingredient list and see what it is. Everything is written in small letters. You have to take a lens and read it, because what is the ingredients in it, you will understand. But with maybe some external applications से आपका थोड़ा relief मिलेगा, but the problem will aggravate and you will end up in some other systemic problem. So what skin manifestation that was coming earlier, you should address it as early as possible. So it is a mirror of the upcoming systemic problem. Or sometimes एक्ने के बारे में, हाइपरपिगमेंटेशन क्यों हो रहा है, you have to assess why it is happening to me. All are exposed to sun, all are having the, we are living in the same society, and one person is getting hyperpigmentation, and the same family member, the other one is not getting. They are having a same lifestyle, same diet. Then why it is so? So that has to be addressed, and so that is the main thing I wanted to address with the skin manifestations.
Yeah,
So
in homeopathy also, we consider, we actually all doctors know that skin is the largest organ,
organ.
supposedly, isn't it?
Mm-hmm.
But
Yes.
for in homeopathy also, we believe that it's not actually believe, it's a fact that should be said. Ki skin actually is the least important organ because
Mm-hmm.
all manifestation, though it is out on
Coming
the
on
surface,
skin,
yes. So it is the internal cause that we
that is
homeopaths,
coming out.
yeah, that is coming out, and we
Mm,
also tell patients कि इसको दबाना नहीं चाहिए. Don't
nature.
suppress it by using
Suppress it.
creams and lotions and
All
everything,
lotions and this
because the disease will penetrate deeper into your
deeper
organism. So
organism.
this is quite similar to what you are saying. So I think
Mm-hmm.
homeopathy, Ayurveda, all these, actual science. So what I want to say here is, when we
Uh-huh.
are talking, we are able to understand that we all are on a same plane actually. When
Okay.
science, जब science की बात हो रही है, तब if viewers are listening today to us, they will come to know that homeopathy
Mm-hmm.
ho, Ayurveda ho, science
Mm-hmm.
is the basic thing which
Basic
is not
thing.
changing, isn't
Same
it?
thing. Uh-huh. It
So
can
I think
explain
even
whole
if
and
today,
why.
even if allopath doctor would have been with us, science will
Okay.
never change.
Change.
Maybe the
Uh-huh.
treatment protocol or the medication will change, but I
Change.
don't
Uh-huh.
think that there is drastic difference between, when positive factor of science is concerned. I
Mm-hmm.
feel so. You are done with your PPT?
हाँ यस गायनाकोलॉजी का एंड स्किन डिसीज इसलिए मैंने ज़्यादा फोकस दिया है क्योंकि दीज आर
Correct.
वेरी rampant in the society and people needs to know this.
Correct. So, how did you feel today's session?
Nice. This just
Nice
like a,
session. Actually,
I
this
enjoy doing it.
series, yes, series I started with the motive that that all doctors from all fields come on this platform, utilize this platform to give correct information. आजकल सब जगह सुनाई देता है word commonly used as misinformation,
Yes.
disinformation.
हाँ
So we are not here to provide any misinformation or
information.
disinformation. मैं viewers को भी बोलना चाहूंगी. We all doctors, whoever are coming in this session, are qualified, registered medical practitioners and doctors and clinicians actually. So आज का टेक ऑफ द सेशन यही है सब व्यूअर्स को कि आप अपने मन से जाके ओवर द काउंटर मेडिकेशंस मत लीजिए. आप जो भी ट्रीटमेंट फॉलो कर रहे हैं, वेदर इट इज होम्योपैथी, वेदर इट इज इवन एलोपैथी, आई वुड से, वेदर इट इज आयुर्वेदा, एनी फॉर्म ऑफ ट्रीटमेंट, don't take it by yourself. There is always pros and cons behind this form of following of treatment कि जिससे हानि भी हो सकती है. So it is always better to do anything with a concern.
Concern.
और हाँ, और आप
You can
अपने
ask, you can ask and clarify why
exactly
it is like that, how it will reverse. All these
correct.
questions, it is a
You should
transparent
ask the
question. You
doctors.
should ask
Yes,
the questions,
you should ask
get
the doctors.
clarified, that get convinced and get clarified by your own.
Get
Don't
informed.
go
Get
with,
informed.
get informed.
And then take the decision because sehat hai to it
Mm-hmm.
should be
You
done
should be
with
more careful.
yes, you should be very careful about it. So I will thank all the viewers जिन्होंने भी आज हमारा ये सेशन देखा है, and thanks to Dr. BG who gave so much time of hers today for this session, and she joined, and she hopefully she has liked it also. And thanks to Awaken India movement and UHO, which is Universal Health Organization, in दोनों के collaboration में I have started actually this platform. And सबसे महत्वपूर्ण बात यानी ये platform QVive network, the director Ashutosh Pathak, we are really thankful to him to give us this opportunity so that doctors will come here and speak their concerns,
Public
share their
awareness. It is very
yes.
beneficial for the general public.
Yes, and lot of people are there who work in the background to make this session
Yes,
happen.
yes,
So technical help always given by technical QWife team, as well as making flyers. We distribute these flyers, so there are people who help in doing all these things. So anything, it's a effort by all. It's not by one who is able to do this. Many people are behind any one session. So I would like to thank everyone.
yes.
And this platform needs more and more I सभी viewers and सभी अगर doctors, interns, कोई students, medical students देख रहा है तो I will also suggest कि आप recommend कीजिए ये show पे आने के लिए and share their views and expertise. And on the flyer, my number is also provided. So if you want to give any feedback or you want to suggest any guest speaker for the next session, you can always contact me, Dr. Gayatri Panditra. And thanks to all of you once again. And
Thank you so
see
much.
you in next session. Thanks.